But let's now take let's take a deeper dive. We have those statistics and we are referencing them and we are citing them, which is okay because that is what we have. But when you take a deeper look at what is available, this graph on your screen, which is obtained from IHME, a 2019 report, we can see the number of countries with underlying data on prevalence of mental health illnesses as of 2019. So for different conditions, you can see that there are fewer of them going to attention deficit hyperactivity disorder. 172 countries, at least they were able to show data. But then what happens to some of these things we had, according to this data set, there are a number of countries that did not have data on the different types of mental health disorders. Alcohol use disorder, about 58%. Anxiety disorder, about 58%. I mean, 58 countries, not percent. 58 countries. So, yet when you look at the mental health research, you can observe that some pockets of publications that are focused on specific communities or specific regions, you will see some of these mental health disorders being reported to have a higher prevalence. So why is it that we don't have data or countries are not indicating to us that they have this data? So this is what we have here. So this speaks to the potential for underreporting or lack of availability. Just a moment. I wanted to look at this slide. The coverage of underlying data on prevalence of major depression. This is a specific one, so we are looking at depression. And this is, that was as of 2008, which is a bit outdated anyway. And it's obtained from Baxter in 2013 there. But we can tell from here that when it comes to Africa, East Sub-Saharan Africa, so this basically shows the share of the adult population for which there has ever been research on the prevalence of major depression, which is defined as having prevalence data collected on each adult age group and gender at the share of the total adult population of that particular region. So you can see here in just toward the bottom of this graph that we have a little bit of a challenge for Africa. Central, Southern, and Eastern Sub-Saharan Africa. It is showing us that it's really very low. So why? For this particular why? So that actually speaks to why we are very keen in this particular area. I have another graph here, which actually shows that there is scarcity of research outputs in the area of mental health in Africa. So this stretches from 1903 to around 2019, which is obtained from this publication there. And we can see the blue curve down there shows the number of publications that are focused on mental health and emanating from Africa. Very, very low. Very low, almost zero, actually. If most of them is just almost zero. Maybe they are less than 10 or something like that, or less than 20 or something. Compared to the global number of publications, which have been increasing over time. So that is really important to know that despite the publication of high-profile reports and promising activities in several African countries, progress in mental health service development has been quite slow. So this is for us to really think about. I want to take a short pause here and hear what people think about this question that we have here. Why is gathering data on mental health a challenge for African countries? People can feel free to put in the chat just so that we can see, or one or two other people can raise their hand and speak to this question. Why do you think gathering information, especially on mental health, is a challenge for African countries? So Diana, you could assist me with that.
Okay, I have Nema. You can unmute and give a response.
Yeah, so thank you very much for this presentation. So I think why there is scarce of data is because of the culture or norms, because as Africans, we don't believe that people have mental health problems. So whenever you raise this issue, it's like they always say, these are not our things, these are not our diseases. People pretend to be sick, but you're not sick. You just have maybe financial problems, or you're just hungry, or you're just having other issues, but not, you cannot have, what is depression? You know, when you want to even try to explain to someone what depression is, they usually say that's not a really problem. So the huge problem with lack of data is the culture. It's not about the money, or it's not about what, but I think it's because of the culture and norms and traditions and how we are raised to, from the childhood to adulthood. We are like, these are not our diseases, these are not our thing, these are just European things are just bringing in, but these are not, they are not real problems. Like, we have other problems, but mental health is not a problem.
Okay, thank you very much, Nema, for that. Yes. So Nema talks about culture and norms, and I've seen a number of people also talk about it there, which I think speaks to what Okari Merafin is also talking about, ignorance on mental health issues. Yeah, indeed, the issue of culture, and Babayo has also mentioned it, lack of awareness about mental health. So thank you very much, Nema. Somebody else?
Amos, you can unmute yourself.
Thank you, Diana, and good afternoon, everyone. This is Amos from Kenya. I'm from Strathmore University. So I think Nema has touched most of the aspects that lead to challenges of acquiring mental health data. And I could just add that also there is, people tend to focus more on the cause of the problem rather than what they are suffering from. Like, someone is suffering from stress or depression, they tend to focus their attention more on what is causing them to be depressed or stressed rather than focusing more on and that's why most attention goes to maybe the causes and all that rather than focusing on the mental health. And then maybe I should take this chance also to ask a question. It's a general one. I was thinking, because of the dynamic aspect of mental health factors and causes, especially at this time where we have aspects like social media and all that. My question is, why can't we be allowed in this program to collect primary data? Because I know primary data could give us more up-to-date information on mental health. That's my question. Thank you so much.
Yeah, so maybe before we go to the question that you've asked, you've talked of, I wanted actually to engage you a little bit more on that, Amos. You talked of causes. Are you referring to stereotyping? But I just want to get some clarity, because I'm not a medical doctor, so but I'm trying to put myself in the shoes of a psychiatrist or a psychologist, that if somebody presented themselves to me with a mental health issue, then the natural thing to do would be to understand what what caused it? Like, how did this? Okay, yeah, okay, we know that you have some challenges. You are depressed, but I would think, and in the case there are people who are more technical than me here, I would expect them to chip in and advise. I wouldn't, in my view, as a layman, I would think it's not okay to just say, okay, here is the medication, but it might be important to take the history to understand why, so that at least when we give when the treatment is given, then that problem is not able to reoccur. So when you say that we tend to focus more on the causes than actually what somebody's suffering from, if I'm wrong, correct me. Are you trying to look at the stereotyping, like where people use, and which is associated with stigma and our culture, to say maybe this person has been bewitched or whatever? Is that what you are referring to, or not? Just clarify, Amos, before you go to your question.
Okay, thank you, Damaso. And not that actually, but what I'm trying to say is that when people present to the issue is actually people don't even notice that they are having mental health issues, because their attention more is on what is causing the issue. Like maybe someone is suffering from financial issues and all that. So they don't realize that they are depressed. That is actually so much tied to what Neema was talking about, considering culture. Our culture does not recognize mental health as such, but someone could go to the hospital not even knowing what they are suffering from, but their mind is mostly or majorly or they even try to deviate their attention towards what is actually causing the problem rather than the actual problem of mental health. So it ends up not being diagnosed as mental health, but maybe another disease that is actually causing the mental health issue. Yeah, that was my point.
Yeah, thank you very much. So I will quickly scan through some of the comments that have come here because of time. We have Anna Jaza. It talks about absence of established data collection mechanisms and priorities. Actually, this is actually in one of my slides to say sometimes the data collection platforms focus on several other things, and maybe you find there one question that is on mental health. I was earlier today in the morning actually with some of my colleagues who are looking at a questionnaire, a very large questionnaire for the demographic health survey, and trying to understand if there are questions that are focused on mental health. And we found there like 1 or 2 questions, I think, if I'm not mistaken. So I think the priorities there that you talk about, very important. Limited diagnosis, that is from Prosper Behombize. It talks about limited diagnosis and treatment centers where it would be easier to gather this data. So yes, you are very right. Because some of the health facilities, indeed, in some of the countries that are visited, you find the psychiatric clinic serving like a very large population with a very large region. So you are very right there, Prosper. We talk, there is also lack of funding from Aston, from Anson. Anson is from Zimbabwe. Serious lack of funding for research in general. So the budgets for research are far less that we have in Africa than in the developed countries. Poor health systems from Sainab, Drame. We've talked about this in terms of which speaks to what Prosper talked about earlier there, the health system is there. Yes, Aris Gita, you are very right about stigma. You are even, so this is not necessarily stigma actually from Aris. Aris talks about people living in denial. It could be, living in denial could also be a consequence of stigma, but it could also be that some of the society or the way society has nurtured us is in such a way that we don't recognize mental health as a challenge. So even when you are mentally disturbed, you live in denial, and it is related to what Kadir Muhammad is talking about there, stigma for people, because people do underreport. Katushabe Jemima talks about governments not prioritizing mental health as a problem. So that is really very important. Thank you very much, Jemima. And Muhammad Kalon Sare talks about limited resources, lack of trained personnel to help educate the general public or population, especially for the rural communities. And then there is also, you talk about the measures for correction, to improve the system. And then you also end by talking about society norms. So I think I will pause there. And there are a number of comments that I can see here that people really understand the issues that are associated with mental health. I wanted to talk about a question, 2 points here from Godfrey Kagai and Maggie Zerari. So Godfrey talks about a point that I want to talk about, which is a lack of standardized tools for mental health disorders that can be applied across different contexts. That is a very important point. And then also Maggie talks about a lack of multi-sectoral coordination and cohesion across different sectors. So quite a number. Thank you very much. I will continue.